and welcome to Bridges. And we are still in the process of speaking about women globally. Women are vital members of every developmental structure. But how far have we gone when we look at women in leadership position, particularly in the health force? And that's where our lens will be on today as we bring you Bridges and examine what women are doing. Is it equitable in terms of position? Is it equitable in terms of what they do and what they earn and what, the kind of recognition they get? So we'll be doing that with the lens of reflecting on, let's say, women in health and leadership 60 years behind. So we're looking at pre-independence, post-independence, and where we are today. And to discuss with me on Bridges, I have with me to my immediate left and within the COVID protocol arrangement, I have Dr. Amina Doraye. Amina is the team leader of Pathfinder International Nigeria, and she has done so much in terms of women's health and public health. By the way, she's a public health expert. Amina, I'm so happy to have you again on Bridges under a very different environment. We're right very close to Mother Earth, you know, and as we all look through using the feminine lens, I also have here two sisters who technology has permitted for them to be with us. First, I'd like to bring on Dr. Adepeju Adeniran. She's an experienced public health physician with over 15 years of experience in public health. And she'll be sharing with us these experience using the feminine lens to see what what are the gaps out there that as women we need to fill within the health workforce. Dr. Adeniran is in Lagos. You're welcome. I hope you can see us. Thank you very much. And you can. Thank you. Thank you. I'd also like to bring on a sister, Canbeth Chika Alaribe. She is in Atlanta, Georgia, and she's here with us. And the interesting thing about these women, particularly women who are interested in well-being of people, is that they have a platform. It's called
Women in Global Health.
Women in Global Health. It's all encompassing. You don't have to be a doctor. You could be a nurse, you could be an accountant, but the driving force for these women is improving the health being of women, and I want to say children, and men inclusive, before we get into trouble here with the men. Okay, so that's where we're going today. But quickly, I'd like to, I'll just give us a little background about what this platform is about before we go into other discussion.
So thank you very much for having me on this platform with a very special edition for us today with nature. So the Women in Global Health movement is actually an initiative that was started in 2015 globally, and then in 2020 more chapters were actually initiated, including the Nigerian chapter. And the whole objective or aim of Women in Global Health is actually to amplify the voices of the beautiful and hardworking women that have been or supported global health generally across the world, and in this case in Nigeria, and to also support other younger women that are coming up to do their best, also to know that there's a platform for them. So there's really no platform that everybody in global health can come together in Nigeria, for instance. So we thought that this would be a very important platform. You don't really have to be a woman though to be in Women in Global Health. You could be a man.
That's the bridge you are building today.
It's a serious bridge because it takes everyone that is interested in gender equality, that is interested in health leadership, and that is interested in health generally to be part of this movement. Yes.
Okay. I'll come to you, Kweju, quickly. And we're looking at the platform that is all encompassing, building a solid bridge that will look at, the public health of individuals. Now, how are you able to function to be able to improve healthcare, let's say?
Thank you very much for this platform. It's such an honor to be here. And I'm going to take off from where Dr. Dorai landed and to say that it takes all of us to deliver global health. So there are two aspects of the fact that global health is something that is especially important in lower to middle income countries because we have a health system that we are trying to build. And then we also have a unique situation in lower to middle income countries, and I speak for Nigeria where we are, and that is contextually we have many of the spaces in which we operate not being gender sensitive, and we can lift off from where some aspects of our culture do not emphasize gender in a way that it is helpful in global health, and we can speak about that as we go along. But when I'm asked the simple question of how do we develop the healthcare system in Nigeria, taking global health, taking gender along, I'd like to speak on the 6 WHO frameworks of the health system, and I'm going to list them, and that is governance. Is number 1 for me, governance or leadership, health workforce, technology, health financing, access to essential medicines, and service delivery. In my experience, I do not believe that we have applied the right gender lens in looking at all these aspects. So in governance and leadership, we're not gender equitable in Nigeria. In health workforce, we're not equitable in Nigeria. And I can speak to that because while you have a lot of women at the bottom of the pyramid doing the actual work, at the public health system, at the public health level, which interestingly is the most accessed point of the health system to the public, women are the ones delivering healthcare as community health workers, as midwives, as extension workers. But when it comes to, and then you have that robust frame, women delivering the system at the bottom, but at the top, you now have a leadership that prioritizes men. So at some point, you have to wonder, there's a gap between the people doing the work and the people dictating the pace.
Thank you very much, Kweju. Very interesting, because that's where we're going, and that's the lens we're wearing today, to examine equitable share of leadership. And I'm sure that we always thought that it was limited to some profession. I didn't know that it also works. It's also a source of concern in the health workforce. Now, thank you. Do you want to jump into this?
Yes, I think it's even more so a source of concern in the health workforce, because we all know that maternal mortality, child mortality are 2 of the most important causes of underdevelopment in our country. And if women are not at the top to amplify, or rather to even advocate for the concerns or the worries of women and children, because that's really their own constituency, then we'll continue to have challenges with how to ensure that women access healthcare, children access healthcare, and even the quality of the healthcare that is being delivered. So if we don't have women to talk for women, I think we are not yet there after 60 years of independence.
After 60 years of independence,
yes.
And it's worrisome because in some places, like Kweju pointed out, find out that the women, they have more confidence when they have their own kind, being able to administer good health or promote good health. Now, quickly, Calder, let's hear your voice, Chika, from Atlanta. You are in these platform, or let's say this movement. What for you? What are the objectives that is driving you to be part of this?
So, like I said, like Pedro had mentioned, thank you, Madame, for giving us opportunity to be on your platform to address some of these issues.
It's our platform.
It's our platform.
Exactly.
Yes. Going off of what Pedro had mentioned, being someone from Nigeria, from America, but I'm born and raised in America, and my family's from Nigeria, it's very essential for me to want to embrace ways that we can all come together and improve the healthcare system in Nigeria, particularly for women and children. So some of the policies that I've noticed in regards to the Nigerian healthcare system don't necessarily cater to women and children. And some of them I will address right now. Some of them include breastfeeding policies. that do not prioritize neonatal health over labor workforce. One of them is no work from home policies during the important months of childhood development. And in situations like that, women have to choose between their work, their career, and their children. So that's something of an issue for a lot of women that are faced in Nigeria. Another thing is the contribution of women to child nutritional, medical, mental, and physical development. Women are working, they're the driving force in the healthcare workforce. So about approximately 70% of women contribute to the healthcare workforce, but they're not in top leadership positions to make decisions or be part of the process of decision making in regards to different policies in regards to maternal health, child health, breastfeeding, a lot of these policies that are necessary. In addition, sexual and reproductive health services, when available, are often dictated by men. And so, for example, if a woman wants to go into a clinic and gets education on sexual and reproductive health, they can no longer do that or make decisions for themselves because they have to go along with a man that has to be present there. So these are the things that are very concerning to me. And as someone that, you know, I love Nigeria, my family's there, I'm from Nigeria. I consider myself Nigerian, even though I'm in America. These policies are very of an issue not only to women in Nigeria, but also women in diaspora that are very, you know, closely tied to Nigeria.
Thank you very much, Chika. Very, very germane those points you've made. Well, let's now look back home, and Amina actually had alluded to that earlier on, and it's that in the last 60 years since Nigeria's independence, what are Nigeria's strengths in regards to women in the health sector? What are the areas for improvement? Because we're actually building a bridge here, and interestingly, the Constitution, it's, you know, we are hoping that some aspect of it would be inscribed in the law that makes it legal, like hopefully we'll have like 50-50, you know, on the side of leadership so that we can drive development faster than it is today. But 60 years on, how would you say Nigeria has fared in women in leadership in the health sector?
I think this is this is a very great question, and one that, you know, after 60 years is very important for us to reflect on what have we done well and what is it that we could do better. So I think in terms of what have we done well, I am sure that 60 years before, of course, we didn't even have up to 5% of women in leadership, especially in the health leadership. But still, 60 years is a long time. As we are right now, we don't have all the studies, but, you know, we have some anecdotal evidence, and we have, you know, done some desk reviews. Less than 30% of women in the health sector are actually in leadership positions that can take very important decisions for women and for the communities at large. And I think this is not really a good representation of Nigeria at 60, because, you know, even Women in Global Health is really moving for a 50-50 representation. Of course, you know, there are more health workers that are women now. As Peju alluded to, we have 70% of the entire health workforce are women, but unfortunately they are at the lower level of the cadre. So at the top level where the decisions are being made, they're just less than 30%. So it doesn't, you know, it means that less than 30% of women are, one, taking decisions for the women in the health sector and for the communities themselves, that we have 50% of women in the Nigerian community. So I think there's a lot that can be done. One, with the policies, as you rightly said, we would love to see a policy that, whether it doesn't depend on who is in power, for instance, but there's a policy that once you're in power, 50% of the cabinet should be women.
Let's hope we would get there. Now, there's an interesting thing that came on while this discussion was going on, and it says, and I'll read it verbatim. It's a question actually. What is the gender inequality? Some say the real pandemic campaign, and what do you hope to achieve with the campaign? This, I think this is a campaign that this platform, your platform, Women in Global Health, are going to. what's this about? I mean, what do you want to, because when we hear pandemic now, people shiver. Yes, you know, you're looking at COVID-19 and the works. So people shiver. So what's this pandemic now?
Yes, so I think for me, I would say that gender inequality has been a pandemic even before COVID-19 came on board.
Okay,
So it's only amplifying the pandemic now. And, you know, we all know the issues about, for instance, gender-based violence that became quite prevalent, or rather that we heard more about, you know, now that during the lockdown. So it is imperative for us to know that gender inequality has been a real pandemic because we have 50% representation of females and males in the country, but then you have less than 20% of representation across the leadership across board. So that is a pandemic because it means those 50% are not being represented, and that is why we continue to have health issues, especially that affect women and children who are the most vulnerable in the society.
Yes, Kweju, I can see you're really anxious to jump on this aspect. Yes, can we hear from you? What are your thoughts?
Yeah. Yeah. So thank you very much, Dr. Dre. As always, wherever she lands, that's where I'm going to take off from.
Nice.
Because absolutely, when we ask ourselves why it's important to have this 50-50 parity and representation, we can show more directly the effects of this in policies. And my sister, Chika, alluded to this when she described, for instance, a breastfeeding policy that said we've always known in global health that breastfeeding is a development issue. And we want children to be well immunized and healthy and grow up. And, you know, we want that. We've known for about 100 years globally how essential breastfeeding is. And yet, even after 100 years of knowing that knowledge, we're still struggling with looking for 6 months for the woman to be able to perform this. And oftentimes in the corporate setting or any other setting, we've positioned ourselves as a system that, oh, you know what, we can't just let the woman be home. What is she doing? Just breastfeeding. But that just breastfeeding is essential to global health. So it's either we are, if we are serious about a policy that is essential to global development, then we must be able to make room for it. And I know that if there were more women in the room, in most places, and this is not a global South problem, even in the global North, many women are given 3 months to breastfeed, and then we want, you know, the children to be breastfed for 6 months. So I'm wondering, where is she supposed to find 3 months from? And we're not doing anything about it. And yet we say we want it to be essential. And those in some place, only recently, less than 15 years ago, were we making it kind of mandatory for places to be able to provide creches for the woman to say, return back to work, but bring your children. And that's 15 years ago. It's a travesty that we've prioritized breastfeeding for 100 years. And for 75 years, we said nothing. Or even 85 years, we said nothing. And then 15 years ago, we were now, okay, maybe you can bring
it's still not available. It's still not available.
And it's still not available in many other places, but we want children to be breastfed. So you see, it's the woman that is having to find her way around this. Maybe have a nanny or ask to work, pump her breast in the middle of the night till 4 a.m., have to get up at 6 a.m. The issue is not so much of how it affects the woman, and that's key, but it also affects the child.
And it does affect the family, actually.
And it affects the family and affects nation building.
There's a gap, and that's what we're trying to build today. You know, build that bridge to fill that gap, to ensure that we can cross over to development as fast as our men are doing, because together would work and do it better. Now, Chika, you have any thoughts on this?
Honestly, Dr. Dre and Peju, they've basically addressed everything that I wanted to state. One thing that I'll address is not just to have and being a part of that process when they're making decisions. You can have a woman as a token woman there in the room and just have her just sit there and then have her listen to what's going on in terms of developing policies, anything of that nature. But make sure that women are also being vocal, that their voices are being heard. That's essential. In order to address all these health disparities that are happening for women and children in Nigeria.
Well, our thoughts had always been that an investment in a woman it's an investment in a community,
Exactly.
because that woman carries a lot with her. And we do hope that as we move forward 60 years after independence, we're moving forward with everyone on board, steering the ship of development. Now, I can see that our time is fast spent, but we're not done yet. So let's start speaking to solutions. How do we get this done? How do we fast track, to ensure that our women are also giving their share in leadership? This is not about capability. You're a doctor. Peju is one. Chika is a public health expert. And there are several nurses, pharmacists across board. Now, how do we ensure, what is it that should be, what bridge should we build to ensure that our women are there, not just in terms of workforce, but also in leadership?
Okay, great. Thank you very much. That's a very important question, I think, at this point. I could say again, 60 years after independence. So for me, I think, as you said, we're all doing a lot individually, and it's great to really contribute to nation building, to the health sector individually, but still we need that movement together. We need to support each other. And when Women in Global Health Nigeria came on board, Pathfinder International saw the need to collaborate with them, considering the fact that we're all working towards the same goal to improve women's health, to ensure that the leadership that is there is really of parity, if I may say. So I think one of the major solutions is what we're trying to do now, to bring everyone together to talk with the same voice, to also identify the women that are doing so much, amplify their voices, elevate their leadership abilities, and also together work with the legislator to talk through policies that would help to ensure that women are on the table at all times.
The biggest things that we are working towards is just bringing other individuals, women like myself from the diaspora who, have always been passionate about, trying to develop and solve solutions in Nigeria, bringing them on board to this platform. And not just women in general, but also youth. We have to think about our young girls. They see, if they see women like us that are, very passionate, driven to change and shape Nigeria into a more positive, a bright country, then when they see they want to be like us. So that's something that we truthfully want to start pushing with this platform, is bringing on the youth.
Yeah, I think the points have been made. Peju, I'll quickly come over to Lagos, and Peju, can we hear from you?
Okay, so again, Chika is very right. It's important that we send the right signals to younger women. It's important that the women who are in leadership are amplified. It's important that growing up, so the fun fact is, growing up, I grew up and I saw you. I remember your name, Mujima Kojonla on NTA. That's one of the things that I saw growing up. And so I saw how you could, how do you send signals? And it was even in that time, it wasn't a space that was easy for a woman to be in. So many of these things.
We're going to discuss women in the media.
It was extremely important for me to see women doing it. So I grew up very fearless. People say, oh, you're so fearless. And I didn't grow up it wasn't a mistake for me to be fearless. It was important that women who had come before me had signaled right and taught me how to fight for my space and fight for what I want. So our mission is to ensure that young women are they want it enough and they're hungry enough, and then to make their own fight a little bit easier. And so that, to continue to build bridges and ladders for younger women to come in.
Thank you so very much. Final word from you.
I think my final words is that Nigeria at 60, we need to have 60% representation. So the numbers, say it for themselves,
All right.
of women.
That's a good note to wrap this up. Yeah. Thank you, Peju, that have been an influence in your life. And I think that's very germane. That's very important, that whatever position as a woman you hold, you must be able to build that bridge or bring that ladder where people also, you can hold hands and ride up to the very top. Now, a lot of issues have been raised here. Policy in terms of ensuring that it's there as law and is legal and is mandatory to ensure that we have women in leadership position, particularly in the health sector. We've also spoken to partnership, and I think partnership is important. Nobody does things in silos anymore, particularly with women and hopefully with men as well. We all need to come together and be able to speak to improvement of healthcare delivery service in Nigeria. I think COVID-19 actually was an eye-opener for areas where we need quick intervention for us all to be inclusive. Diseases, they say, don't have borders. Exactly. But I think that women bear the brunt when there's a poor health system exists. So as we build the bridge and hopefully on women in global health, should I say Nigeria, we just hope that this will translate into more women in leadership position. It will translate into more women in leadership position. But we won't sit on the fence and hope to get it. I'm using we now because after all, I'm a woman. Exactly. Right. So, but together, we will build a better Nigeria. And that way, the Nigeria of your dream will come to be. Thanks for watching.